Hi everybody! So today we're going to be doing our presentation based off of necrotizing fasciitis. The presentation will be presented by Talia, Regan, Skylar, and Zakia. Before we begin our presentation, I would like to pronounce the land acknowledgement. Medicine Hat College acknowledges and honors the traditional territories of the First Nation people of Treaty 7, Treaty 4, and Métis people who share a deep history with this land. We recognize and honor land, history, ways of being, and our relationship with the First Nations, Métis, and Inuit people as we forge together towards a relationship of reconciliation, respect, understanding, and healing. What exactly is necrotizing fasciitis? Necrotizing fasciitis is more commonly known as a flesh-eating disease. It is a very severe bacterial infection that spreads quickly through the tissue surrounding the muscles. The word necrotizing refers to something that causes death of something else. The word fasciitis refers to inflammation of the fascia, which is the subcutaneous, meaning underneath the skin, tissue that surrounds muscles and nerves and holds everything, including fat and blood vessels, in the correct position. What are the symptoms of necrotizing fasciitis? Early symptoms of this condition include signs and symptoms that resemble those of a flu. Body aches, fever, chills, nausea, diarrhea, and severe pain at the site of injury. This injury can extend all the way from a paper cut to a puncture wound. The progression of necrotizing fasciitis is very quick. Later signs and symptoms include reddened or discolored skin, swelling of affected tissues, unstable blood flow, blisters filled with bloody, yellowish, grayish fluid, tissue death, low blood pressure, and sepsis.
How can it be prevented? First, it is important to know how we can prevent necrotizing fasciitis. Keeping wounds clean is very important, especially those who are diabetic and could have diabetic neuropathy, for example. Hand hygiene is very important to help maintain clean wounds. It is also important to follow wound care directly. Change bandages or dressings when it is due. Your doctor or wound care specialist might also have specific wound care instructions that should not be ignored. Doing so could result in necrotic tissue and potential for it to spread. Avascular necrosis is most commonly in your long bones, and heavy drinking is one of the top risk factors for developing it. Bits of fat are common for blocking blood supply to bones. Important to stay on top of our checkups and keep cholesterol levels low. Bone damage can result from repeated courses of high doses of steroids. Consult your doctor before going on excessive steroid use. How is it treated? If you get necrotizing fasciitis, it is important to know all the possible scenarios how it could be treated. Treatment should be early and aggressive. The longer you wait, the more it could spread and damage tissues and other parts of your body. Surgical exploration and debridement are required. Debridement is the removal of damaged and infected dead tissue in that area. On very excessive necrotic damage, it usually takes up to 3 surgeries to ensure all of the infection is gone. The wound would be left open to closely re-inspect 24 hours later of debridement. When it is confirmed that group strep A is the cause, antibiotic therapy such as high-dose penicillin, ampicillin, and clindamycin is given. The antibiotics will help the toxin production from the necrotic tissue. Not as effective, but in severe necrotizing fasciitis, intravenous immunoglobulins could be considered to help. The best case scenario is that the surgical debridement of the dead tissue was a success. Skin grafts or plastic surgery would be used to help wounds close completely. Unfortunately, the worst case scenario would be that the necrotic tissue has spread too much for the use of debridement and could result in amputation of that limb.
The bacteria that can cause necrotizing fasciitis can enter the body through surgical wounds, puncture wounds, or other injuries, burns, minor cuts, insect bites, and abrasions. In some cases, it is unknown how the infection began. Once it takes hold, the infection rapidly destroys muscle, skin, and fat tissue. Having a weak immune system and certain diseases can make you more likely to get flesh-eating bacteria or necrotizing fasciitis. Health conditions that may raise your risk include alcohol abuse, cancer, if you had chicken pox in your childhood, cirrhosis, diabetes, heart disease affecting the heart valves, chronic kidney disease, lung disease including tuberculosis, peripheral vascular disease, steroid use, and the use of injectable or IV drugs. How does necrotizing fasciitis spread? Group A streptococcus virus spread by contact with saliva or mucus from the mouth, nose, or throat of an infected person. The infected person may or may not know they have symptoms. When an infected person coughs or sneezes, the bacteria spread through droplets in the air. You can become infected when you breathe in these droplets, touch objects that are contaminated with them, and then touch your eyes or mucous membranes or put your hands in your mouth. The bacteria can also spread through close personal contact, for example, kissing or sharing drinking cups, forks, spoons, or cigarettes. Those at high risk of getting it from an infected person are people living in the same household as the infected person, people who sleep in the same room as the infected person, and people who have direct contact with the infected person's mouth or nose secretions.
Necrotizing fasciitis is rarely contagious and occurs randomly. Most cases of invasive strep A do not present as necrotizing fasciitis. According to Manitoba Public Health, there are 90 to 200 cases of necrotizing fasciitis per year in Canada, of which about 20 to 30% are fatal. There are two types of necrotizing fasciitis: polymicrobial, also called type 1, and monomicrobial, also called type 2. Type 1 is caused by Staphylococcus aureus, Haemophilus or Vibrio, and is usually seen in older patients or those who have diabetes mellitus. Type 2 is caused by Clostridium perfringens or Clostridium specticum, and is usually seen after injury or surgery and is presented as gas under the skin. There are 3 stages of necrotizing fasciitis. Stage 1 is tenderness to palpation, arrhythmia, swelling, warm skin, also known as calor. Stage 2 is blister or serous fluid formation. Stage 3 is crepitus, skin anesthesia, and skin necrosis.